passed in March of last year. And I wanted to ask you about some of the provisions of the Act and see if you think some of these provisions are good ones. You mentioned healthcare just a moment ago. So, first one prohibits denying insurance coverage to children based on pre-existing conditions. Good idea.
Why don't you run through them and then I'll address them in mass.
Children will be allowed to stay on their parents' plan until they turn 26 years old. Provides access to insurance for uninsured Americans with pre-existing conditions. Eliminates annual and lifetime limits on insurance coverage. Provides small business health insurance tax credits to help provide insurance to their workers. Provides free preventative services such as mammograms, colonoscopies without charging a deductible, copay, or coinsurance. And that's a short list, but there is one more that I wanted to mention, and that is it establishes an affordable insurance exchange. If your employer doesn't offer insurance, you'll be able to buy it directly in an affordable insurance exchange, which is what will be offered to representatives of Congress in the year 2014. So you'll be getting your insurance through an exchange.
Great. Thank you. Okay, so you've mentioned a number of policy decisions that were made through the Affordable Care Act, also known as Obamacare, including those you mentioned extending coverage for dependent children up to the age of 26 years old, eliminating some restrictions sometimes imposed by insurance companies based on pre-existing conditions, eliminating lifetime limits, offering tax credits, free preventative care, and an insurance exchange system. Each of these issues relates to a substantive policy concern, substantive policy debate related to health insurance, a very important issue in America. Let me make one thing very clear. The question isn't whether those are good things. Many, even most of those things, do something that is good in the sense that it accomplishes something, it satisfies a need, a desire that we have as a people to come up with an insurance system, a health delivery system that's more effective. The problem is that it's done in one fell swoop at the federal level. Every one of those issues is a state issue. There is nothing in my copy of the Constitution that gives Congress that power to tell me whether